Assalamualaikum warahmatullahi wabarakatuh, ladies and gentlemen. I would like to explain our study about evaluations of community health volunteers training on early detection skills of pulmonary tuberculosis in a primary healthcare facilities. This study conducted by Sri Wahyuni, Sri Widyati, Muhammad Jauhar, and Arwani. I came from Nursing Department, Faculty of Health Sciences, Universitas Muhammadiyah Kudus. The presentation outlines consist of introduction, methods, result, discussion, conclusion, and references. As we know that tuberculosis is an infectious disease that become a public health problem globally and nationally. Based on this, the issues of TB was included in the health policy of the Millennium Development Goals or MDGs in 2015 and continues on the Sustainable Development Goals in 2013. The incidence of TB in Indonesia has reached 842,000 cases with a mortality rate of 107,000 cases. Indonesia is a country with the second highest numbers of the new cases in the world. The detection of positive BTA-TB cases in 2018 has increased compared to 2017, namely 121 per 100,000 population in Central Java province. Kebumen Regency with the target case detection rate was 2,284 cases and only 1,998 cases were achieved. Kuto Winangun primary healthcare facilities with target of 89 cases, only 14 cases were achieved in 2018. This shows the low numbers of cases findings. The conditions is caused by the lack of human resources at the primary healthcare services and the dual duties of TB programmers in the implementations of activities. The interventions recently use educations with the theory plan behaviors or TPB approach. So the solutions is early detection include providing information about TB and TB case finding through lectures, discussions, and demonstrations, distributing training modules to health cadres, encouraging health cadres to actively seek information about suspect through community meetings, encourage health cadres to provide health educations about TB to the community. The study method, the design of the study used quasi-experimental design with the type of pre-test and post-test group designed with control group. The study was approved ethical clearance from the Ethics Committee of the Faculty of Public Health Universitas Muhammadiyah Semarang. The population and sample, the total samples was 32 people for each intervention and control group. Data collections, the interventions, the training was carried out in 5 face-to-face sessions for 5 days in 60 minutes per sessions. The procedures, researchers provide information about the study and inform consent to health cadres. Researchers measured TB early detection skills before and after training. Health cadres receive TB early detection training modules. The instruments was used materials provided consist of basic concept of TB early detection skills, effective communication, TB early detections, practice, and evaluations of activities. The data analysis consists of univariate and bivariate. The univariate analysis described in frequencies and percentage, and for bivariate analysis use priority test and independent test. The result of this study we can see in the table 1. The table 1 is the descriptions of characteristics of health carers based on sex, education levels, and training history. The most of health carers was female. And then the education level was senior high school and has historical training before. Table 2, the descriptions of the characteristics of health carers based on age and length of service of health carers. In this table, we can see that the mean of age of health carers for control group is 45 years old, and the interventions group is 47 years old. The work period as a health carers for the control group was 50, and the interventions is 52. 52. They has become a cadres. The descriptions of TB early detection skills for health carers in the interventions and control groups before and after in the intervention, we can see in the table 2. Early detection skill in before for intervention groups, the mean is 30.38, and after is 41.88. For the control group, the mean of early detection skills was 27.78, and after training, the early detection skills in the control groups was 31.78. Table 4 shows the difference in TB early detection skills for health carers in the interventions and control group before and after the intervention. We can see that both interventions and control, so the p-values were 0.000. Table 5 shows the effect of health carers training on TB early detection skills with p-value 0.000. The health carers had previously attended training on the management of TB patients in the community, but after being evaluated, there was still a need for monitoring and common perceptions. It was evidence that health carers were not capable yet of screening TB, especially when sending sputum samples to the laboratory. The training that has been carried out in 2019 in the form of TBC training of trainers. The average working period of health carers is more than 15 months. Health carers who have experiences before will have better mastery of the materials and are more skilled at communicating. The result of the study showed the difference in the skills of TB health carers before and after the interventions as an evidence by the increased ability of cadres in communications, providing information, and early detection skills. There is an effect of training of health cadres on TB early detection skills. The skills of health cadres in communicating are increased and more focused during demonstrations and direct practice with the suspect. Community health nurses must work closely with health cadres to solve health problems because active participants from the community will increase ability to achieve optimal community health status. The conclusion is there is a significant effect of health cadres training on improving TB early detection skills. health cadres as the extensions of health workers in breaking the chain of TB disease transmissions in the community need to be equipped with sufficient knowledge and skills so that they are able to carry out their roles and duties. Various forms of supporting media can be developed based on needs such as modules, manual books, guideline, and so on. This is the reference. That's all. I think enough for our presentations. Thank you for your attentions. Wassalamualaikum warahmatullahi wabarakatuh.